Good day, everybody, and welcome to this episode of VISTV. I'm Joan, and today I am really happy to introduce Dr. Darcy Sterling. Darcy is a New York City therapist and the host of E-Network's Famously Single. Did I say that right, Darcy?
Did.
Great. And I'm so happy to have you here.
Oh, thank you for having me, Joan.
Pleasure. Last year, VISTV focused on leadership, motivational leaders. How do we maintain healthy environments? This year, my focus really is on the individual employee, people in the workplace, and how do we assist them in being mentally healthy? You probably know much more than I the data that's currently available. The Times just put out an article this week on the impact that mental health has on individuals, how there's a rise in anxiety, depression. The pandemic affected that. So I'd like to start there, if you would.
Sure, absolutely.
And then kind of segue into what can we do to make society better in the workplace?
Yeah, I mean, look, we are indisputably in a global mental health crisis right now. The pandemic threw everybody into a crisis, including the providers. And at the same time, we have a deficit of mental health professionals, which has resulted in a myriad of other problems. We've got, it's opened a doorway for paraprofessionals who are not necessarily trained and call themselves coaches or trauma coaches or anxiety coaches who have no training whatsoever to create platforms on social media or however they create their platforms. And that has resulted in secondary and tertiary trauma in so many people because they're not able to get their mental health needs met because we have a deficit of providers. So for sure, the pandemic has strained my industry and it's really created a complete paradigm shift. The bright side to it is that mental health professionals had been very slow to embrace technology, which has been available for a decade before the pandemic. Technology video calls that allows us to be available to so many people who otherwise would not be able to get to us. And it's so much more convenient to see people on video calls. In my practice has been employing video calls. We were doing it back when Skype was a new thing. And what it does is it really breaks down boundaries, geographic boundaries, and it allows people to see the best professionals, provided that they have the resources to do that and not be limited to those that they're able to actually get to in person. So the pandemic has done some amazing things in terms of making us more available to more people, which I think is really, really important.
I think you might have just helped me to understand something that could be a focus on healthcare moving forward. So when I look at the situation of mental health, my primary focus is on an employee. And as a leader of a company, mid-sized company, small company, it's very different than a large company. Maybe what you just said would be the greatest tool that companies could use if we provide time for individual employees to sit down with healthcare providers like yourself.
Absolutely. If you can carve out, give people a floating hour or an hour and a half in their work week that they can use anytime they want, and I don't know if your company is virtual, but certainly
we're hybrid, but I think as a society, we've all moved virtually. To your comment on providers and care, most providers now offer telemedicine visits. They would be unemployed if they were not doing that. What do we look for in employees that we feel might need a little assistance, that may be struggling?
So the people that I work with, my ideal client is not even somebody who is struggling. I don't think you should have to be struggling to get mental health services. So one of the things that I do let me just start by saying, if you think about mental health, I'm trying to think of do I have a prop here? I'll use my phone as a prop. Remember when we were learning how to add and divide, and we had in like as little kids, and we had those number lines on our desks, and in the middle it was 0, and here are the negative numbers and here are the positive numbers. Most people who come to a mental health professional are in the negatives over here, and the hope is to just get them close to 0, which is no symptoms, asymptomatic. The majority of my clients are already asymptomatic, and I'm working with them on the other end of the mental health spectrum. I'm helping people to thrive. So as an employer, I would want my employees to not be limping before they could get services. I would encourage them to have an annual mental health checkup, which is something that our practice does for existing clients. When we complete our work with our clients, we schedule 1 or 2 times a year check-ins with our clients whose work is completed, just for them to have the accountability of showing up and reflecting. How am I? Because, life is busy. It's very, very easy and convenient, emotionally convenient, to not be plugged into how we're feeling. And that moment of reflection can sometimes be a turning point and help somebody bypass the need for medication. If we can bump up the self-care at the beginning warning signs that they need additional support. So I didn't answer your question, Joan.
No, you actually, you actually made me take a step back, which I think we're never too old to learn. My statement was old and archaic to say, what are we looking for in people who are struggling? You're 100% right. As an employer, I want people just to be well. Right. And what does well mean? And it's what wellness is different. As a nurse, wellness is different for everybody. And you really made me think about it a little bit differently, which is important. And I hope our audience sees it differently.
It's a paradigm shift. It's not even you or age or anything. When, as mental health professionals, just as nurses, any healthcare provider, to remain licensed, we have to complete something called continuing education credits or units, where we are constantly going to trainings. And anytime I've gone to trainings, back before the pandemic, where we were in person, and we would go around and introduce ourselves and talk about our population and who we service, whenever I would explain, I work with people who are generally looking to improve their lives, not trying to stop the bleeding or the hemorrhaging. My colleagues would snicker and say, wow, it must be really hard to work with people who don't need help. To which I would say, every student learns differently. And I would argue that the way that you work with special ed kids is different from the way you work with gifted and talented kids. My clients are gifted and talented people who happen to be doing well by all markers of their life, and they want more. And and my clients are so challenging in a very different way than clients that who are combating and living with chronic mental health issues. Different kind of muscle is required for both of them. So I just want to normalize your perception and say
I appreciate that.
It's generalizable in my whole field. People have always thought that is a ridiculous way to practice.
No, I think wellness is on a scale. I liked your analogy. I liked you using your phone. I think wellness falls on a scale. We are all somewhere on that spectrum, and everyone can be better. Mm-hmm. And I just want to encourage leaders in any industry, any work industry, whether it's construction workers, real estate, management people, delivery companies, just to be aware that you want your base of employees to be well.
Right. And I mean, it's the same thing with trainings. Like, there are trainings that will optimize their not only their level of productivity, but their happiness and their well-being. Employees, by and large, like trainings, provided the trainings are done well and they're not condescending or pedantic. But people enjoy growing. They want to learn, they want to reach, they want to stretch and see possibility in where they can go in their careers. And if we can support them, not just with, but trainings is another piece of it, right? I'm sure
that's a great suggestion. Yeah.
Yeah.
You're providing support, whether it's in your own industry or outside of it.
You know,
Yeah,
it's
no.
one thing to do an annual review or a quarterly review with an employee and tell them what they're doing well and where they need to improve. And it's an entirely different thing to have suggestions. And so here is where I think you can develop. Here is a program that we're happy to pay for. If you would like to do this, you know, you can have 3 days and you can go into this program. It's called Momentum or Landmark or whatever it is. It's really going to help you reflect on yourself so that some of the interpersonal problems that you've been experiencing on your team, you'll be better equipped to handle them. Because those are relationships.
It's exactly relationships. And you, as an expert in relationships, will segue a little bit in. Any tips for employees and employers to have an open relationship? What comes to mind when you think of promoting the best relationships for work in the workplace?
You know, I think that mental health, like any kind of health, like any kind of leadership, trickles down. And I think that the mental health of the person at the top is going to inform how everybody in that organization approaches not only mental health, but relationships and communication. So leaders have to do their own work, and an unexamined life is not a enormous missed opportunity. Everyone should have done their own therapy and should consistently or intermittently be revisiting their own therapy, because none of us are, I mean, it's a growth mindset. That's the mindset that I approach life with. I always want to be growing and learning and you know, challenging myself. So leaders have to do their own work. And as an offset of that, when we're better grounded and our egos are more in check, we are better equipped and more able to invite open dialogue with our employees. It takes a very, very strong and grounded human being to encourage pushback from their team members. When you're at the top of an organization and you ask for feedback, you have to have a culture that invites feedback and welcomes feedback if you expect to get any real feedback. Otherwise, it's just bullshit. You're just getting, you know, you're just going to get the head nod. No, it's great. It's great. We'll do it your way, Darcy. I don't want to work like that with my employees. I don't want to work with that like that with my clients, you know, and I am certainly not the poster child for mental health. Let's just be clear. I hope that I am an example of somebody who consistently tries to be better. So, you know, having a culture where people are allowed to disagree without being disagreeable, where people are invited to push back, where people are invited to talk to one another about how they're feeling, that again, it starts from the top and it trickles down. If the person at the top can turn to the person next to them and say, you know, after the meeting is over, I don't know if you meant it that way, but it didn't land. It didn't land good. I feel, I'm not sure if I'm sensitive or if there's something going on, but I need to let you know that that remark, it left me feeling really uncomfortable. That you are then modeling for that person that they can do that back to you. And that's a whole different approach to communication than just, you know, most small to medium-sized companies just want their workers to work. And that's not realistic. We're human beings. We have to have quality of life. And that starts in the workplace.
Bravo. Wow. Darcy, Dr. Sterling, amazing. Really amazing, because you hit on so many things that I hope people hear. As a leader, I I entered therapy probably about a year ago, and shout out to my therapist.
Yes, good for
and,
you.
and it really has changed my perspective. What I wanted was my perspective on myself first, but it really changed my perspective on individuals and individualism. And it gave me really a concrete foundation on where to go and where to bring ideas that I have, thoughts that I have, but also to be that model to my company, that mental health is so important. Physical health, we promote it constantly.
Right. And they're interrelated.
They're interrelated. Exactly.
I'm curious, what about individualism did you want to examine?
Well, let's see if this stays on or off the record. I individually, came from a background of dysfunction. I was raised in a family of dysfunction. There was trauma associated with it. And I really didn't know till my children were older and sought their own exploration that you can really delve into the why you do things the way you do. And they're not always right just because you succeeded at it.
Right. I love that. Just because you're successful doesn't make it right, and doesn't mean that you're stuck in a pattern where you have to keep doing things that way. When when you've done your own work, there are more options available to you. And maybe you stick with the same way of doing it.
Maybe
that's an option.
But maybe the focus too shifts, especially my generation. When I was raised, you had three choices. You could be a nun, a teacher, or a nurse. Well, wow. At different stages, I wanted to be all of the above.
Did you really? That's fascinating.
But I wasn't given the strength or the fortitude to now be where I am, running a woman-owned business, where I have a voice that I believe is equal to everyone else. So therapy has actually helped me not just say that, but understand what it means.
Right.
Understand really what's the core of where did that come from? And why do I want to promote that? And I think you can't promote as a nurse, nor as a leader, mental health if you're not taking care of yourself.
100%. That's why I said when we're talking about how we can make relationships and environments in the workplace healthier, it starts with the leaders. Everyone has to do their own work. We all have to do our own work. At the top of the pandemic, was I already in couples? No, but we were talking about it before the pandemic started. I was already talking with my wife about going back into couples therapy. We started off once a week, then we upped it to 2 times a week, then we were up it to 3 times a week. And I was like, listen, we're all but moving in with you. I'm like, you got to help us stop the bleeding. And within 6 months, we were back down to once a week. And but it's something that I'm very open and transparent about, because I mean, we're too, aside from the fact, forget that we're shrinks. My wife, by the way, is also a therapist. So, I mean, forget that we're therapists. Let's just pretend that we're two different professionals. Suddenly, we're like having to work in a small space. We're not leaving the house. And the only 2 people we're seeing is the only one other person. I mean, it's a strain on anybody. Exactly. And relationships, irrespective of what's going on in the culture around them, we all need tune-ups. We all need periods of time where we're getting assistance from somebody. I think of a relationship as a car. You would never not change the oil and filter. You would never not rotate the tires. And if you neglected the car, you would absolutely expect for the car to break down.
Exactly. And that's how many people neglect themselves. We neglect ourselves. And I think it's time as a society, it's time as leaders that we value that in the people that we work with. Yeah,
I agree. I agree. So have you found the process? I guess this TV that you've been doing has been an offshoot of it. So I guess
it's definitely been an offshoot of what I think where the conversation's missing in the industry that I work in. So I work in the insurance industry. That's a gamut of all types of insurance, but it's missing. It's an old industry. It's one of the oldest industries. You have to be insured for everything: homeowners, car, work, you name it. And there's no conversation Yet in the health insurance industry, there should be. It's starting, it's there, but it's really, really important. And I think we can get on hours of this as women.
Right.
We are not given the tools as young girls, especially my generation, to take care of yourself, that it's okay to stop and take care of yourself.
Yeah, I'll tell you, as somebody whose practice is rooted in New York City, one of the first things I do with, I want to say 95% of my clients, if not, maybe it's closer to 100%, is the first 30 days of working with them, I write them a prescription for self-care. Literally, I tell them your water intake needs to be improved, your food, the thought around your meal plans, which is non-existent, that needs to change. We need to correct your sleep. We need to get you moving. And we need to make sure that you've got some quiet time every day for reflection. And I put together a program for them, and they will often say, I feel so foolish. Like, I'm coming to a therapist and you're monitoring my water intake, you're monitoring. And I'm like, right. And we're 4 weeks in and 50% of your anxiety has dissipated. If I hadn't done that, we would have sent you to a psychiatrist. You would have been medicated.
That's a great checklist.
Right, but now you can already see how much has improved, and it's just 4 weeks. So let's repeat this another 4 weeks and see how much more we can bring it down. We probably won't bring it down another 50%, but hell, if we can get it down another 20%, what is that? I'm not good at math. 70%. That's 70% of improvement by drinking water and
by caring for yourself.
And that's just it. I think that women all over, and for sure in different generations, I mean, older generations, it was never even spoken about. Self-care was like ridiculous. I don't think my mother had ever even heard the word or the phrase. When I would tell my mother that, Mom, you need to up your water, she would bring up her coffee and say, Darce, there's water in this. And I'd say, it's not the same thing. That doesnn't count.
We have done a lot of interviews with different people in wellness, and hydration is always so big, so big.
And you know what my clients complain about? Well, it's making me have to go to the bathroom every hour. I'm like, I'm not a medical professional, but I am pretty sure that is the proper way for kidney functioning.
It's health. It's health.
And also getting off your chair and moving around, that's also ideal for mental health.
Moving, that's what I encourage. We have breaks in the day, get up and move. And it's so hard to encourage people to get up and move.
Well, you can start by doing a standing desk yourself.
Exactly. All right. Now, if everybody heard that, I'm in big trouble right now.
But it's true. I mean,
no, it's very true.
I can literally.
I have to be an example. I
have the hyperactivity component, so it comes easier to me. It's like I almost have to be restrained to sit in the chair. But like every 2 hours, I will stand up. I'll turn around. I'll put my computer on the bookcase, and that's the right height for me. And I'll stand for 2 hours or an hour.
Darcy, I have listened to so many wellness coaches. I've got that down. I get up, I move, I take walks. I want
so now do some standing sessions, standing meetings. Yeah. The other thing is that I mean, it is important for us to bring in trainers in companies, people like me who are consultants and can come in and speak to the employees and hear from the employees in ways that they won't talk to the leaders in the company, find out what the cultural needs are, and then offer, specific trainings.
And offer them the time to do that.
Yeah. I mean, that's another way of doing it.
You've given me tremendous amount of suggestion, encouragement. I hope the people listening take it. I hope they treat their employees better. I hope the employees feel the strength to come to their employers. And it's really important. What you're doing is really important.
Thank you. Thank you.
Thanks for taking the time.
My pleasure. Thanks for having me
today. I know you are a busy person, so I really, really appreciate it.